in already.
Hi, sorry I'm late. It's nice to meet you. I'm Dr. Catherine Moore.
Blanche.
So are you a tennis fan?
No.
Oh, you're reading Tennis Magazine.
We have nothing else here.
Okay. Well, what brings you in today?
Well, it's like this. I have some pain, my chest, and in my shoulder. But it goes away when I don't do anything.
So
My back too.
Yeah, okay, so like resting or laying down is when it goes away?
Yep.
Okay. And it gets worse when you're active?
Yep.
Okay. And which side is the thoracic region? Your chest pain again?
My left side. Can I go now? Well, I'm here because my daughter made me come here.
No, not yet. Can you think of any other symptoms that you may have that you may be experiencing?
Well, it's been kind of hard to eat my meals without having belly pain recently.
Bad indigestion. All right, anything else? Are you under any more stress than normal?
Well, my youngest went off to college not too long ago, so I'm a bit worried about her.
Yeah, understandable. All right, I'm just gonna do a small physical examination. Okay, I'm just gonna need to take your heart rate, listen to your blood pressure, that kind of stuff. All right? Okay. Can you stop chewing? We'll just stop there. Okay. Heart rate's a little elevated. Is it usually that high? Okay. And just listen to your lungs. You sound clear. Okay, I'm gonna need you to roll up your sleeve while I take your blood pressure. Thank you. Stop. That does nothing. That does nothing helpful. Okay.
But it's so fun.
Your blood pressure's a little elevated. Okay. Also wanted to do a bit of a physical exam. I have to press on your chest now. Okay. Is that where it hurts most? Okay. And your stomach? What is
Not as
that?
bad as the chest.
Okay. Just flip it on your back for me. Is that?
Yeah, that's bad.
Okay. And sit up straight, please. I'm going to press on your shoulders. Watch your goldfish. Right there.
Yeah.
Okay. Okay. You can get comfortable again. Blanche, I understand the nurse examined you. She took your temperature and it was a little high. Not too concerning though, but it was elevated as your blood pressure and your heart rate were. You see that your father had a heart attack and your paternal grandfather died of a stroke? Is that true? Yeah, okay. Both of them also had high cholesterol. That tells me that you are probably predisposed to heart disease. I have an idea of what you might have, what you might be suffering from, but I'd like to run some further tests to diagnose you.
But what is it?
We don't have to talk about it right now. I mean,
What could I have?
I believe you're suffering from some type of heart disease, but again, I won't be sure and I won't know exactly what it is until we run some further tests.
All right.
All right, we can do them now if you want.
Please do.
Okay, I'll send Dr. Shawn in to let you know what we're up to. She's a very good doctor. She'll be running all your tests, and feel free to ask her any questions. Don't worry, okay? We will get to the bottom of this, and as soon as we know what it is, we'll let you know. All right?
Thanks. Come in.
Dr. Moore left her computer open again. Thank you.
No problem.
So, hello, I'm Dr. Catherine Schoen. Pleased to meet you.
Blanche, usual.
I'm going to discuss the tests we'll do. If you have any questions, please stop me at any time.
Okay.
So first we'd like to do a blood test to check the levels of certain fats, cholesterols, and proteins and sugars. We need to do the following: blood chemical, blood glucose, kidney, blood enzyme, and lipoprotein blood panel.
It's a lot of blood.
Don't worry, you have plenty. The next test we'll do is a chest x-ray.
I know all about this. I have one, so I'm good.
That's good. Well, we're going to get one of your heart. We're also going to have to do a stress test. Don't worry, you'll just have to walk on a treadmill for a little bit. Okay, then we're going to do an echocardiography. It's basically a non-invasive ultrasound of your heart.
I like non-invasive.
Well, that's good. Everyone likes non-invasive. However, these tests are not typically conclusive, especially in women. In order to give you a sure diagnosis, we will need to do a coronary angiography. To do this, we'll insert a shunt in an artery on your leg or arm and then inject a dye.
Will I be asleep?
No, typically not, but because of your history and your lifestyle, we'd like to do the angiography. We won't have to go far, seeing as that we're in a hospital. All of these things can be done today.
Okay.
Come in. Hey, Doc.
Hello.
Did you see her? She ate goldfish through the entire exam. Like, I couldn't even, I couldn't take her heart rate without her, sneaking a goldfish.
What? That is so cray.
I know, right? Well, anyway. So, Catherine, what'd you get from the test?
So I found that her cholesterol is 240 and her triglycerides are 250. Her blood sugar is a little low, but that's okay because she has type 2 diabetes. And then everything else is within the normal range.
She'll need to lay off those chips and the goldfish. I saw her. She had some fish sticks in her pocket. She's definitely gonna have to get rid of those too. Oh, and she can't smoke anymore. That's not good.
Yeah, obviously.
What else did you get?
So in her x-ray, the heart is enlarged to the left and there are a few blood vessels that are partially blocked. And I see there's abnormal calcification, which is hardened blockage due to cholesterol buildup in one main blood vessel.
I think I'm convinced.
And the other tests only confirm your suspicions.
Yeah.
She wasn't able to walk more than 2 minutes without exceeding 90% of her heart rate capacity. And then finally, the coronary angiography showed that there are many partially blocked vessels.
Okay. Oh, I think I should talk to her, right away. I need to start her on some blood thinners and some anti-clotting agents.
Well, I'll bring her in right away.
Sup, Doc?
Hey, Blanche.
Have a magazine?
Okay. Am I boring you that much?
Yep.
Okay, well, I'm sure that you're stressed and anxious enough as it is, so I'll get right down to the point.
Okay.
Okay. I'm diagnosing you with coronary heart disease, and it's at stage 2.
What's that?
Basically, it's saying that your heart isn't healthy enough because there's a substance called plaque, and it's partially blocking some of your arteries. This restricts blood flow, and it causes you shortness of breath and soreness and pain. There's too much strain on your heart with your unhealthy lifestyle, as well as your predisposition from your father's side of the family. And right now, nothing serious right now, I just want to put you on some medications so it'll prevent blood clotting and thin your blood out. And hopefully this will prevent further clotting.
Okay.
Alright. You also are going to have a routine blood check because of these medications I'm putting you on. They can be kind of dangerous.
Alright.
And I'm also going to require you to change your lifestyle. So you have to eat better, starting with the goldfish.
No!
Yeah, I'm going to have to. Thank you. And I think do you have those fish sticks too? I saw that. And the Cheez-Its, I think. Yeah, okay. You're also going to have to start exercising to keep healthy. You'll like it, I promise. And you also really have to limit your alcohol consumption and get rid of those cigarettes.
Okay.
You do. You have to. It's imperative.
Fine.
Okay. In a month, I'll call you back in for a checkup, and if you're not improving, I'm going to recommend either an angioplasty to clear up some of the plaque, the partially blocked arteries, or a coronary artery bypassing graft, okay?
Should I be worried?
No, not yet. We'll see how you do. If you have any more troubles between now and the next appointment, of course come see me, but I have confidence you'll be okay.
Thanks, Doc. I'll do that.
Okay, and just write the prescription for the blood thinners. Okay, and I'll see you in a few months. No! When Blanche came back 1 month later for her checkup, she was already improving. Therefore, there was no reason for an angioplasty or coronary artery bypass. When we took her blood test, we found there was a significantly lowered fat and bad cholesterol content. As for the medications, fortunately, the blood thinners were not causing any problems in Blanche's everyday life. Most importantly, she's been cooperative in changing her lifestyle. She immediately signed up for a program to help her stop smoking. Although it was difficult, she was able to give up smoking and excessive drinking. Blanche is now much healthier. Although she still works at McDonald's, she no longer eats there. Instead, Blanche is on a DASH eating program. She eats at home and has generally cut down the amount of cholesterol and fat in her diet. Now she mainly eats a lot of fruits and vegetables and fish, and food with a lot of whole grain. By exercising every day at the gym, Blanche can now run a mile without stopping, and she feels better overall. All of this has definitely helped her feel less stressed. As long as Blanche keeps this up, she is on the road to recovery.